Hello, welcome to another episode of Live Nouvelle Esprit Presents. In this episode, we tackle how to understand medical marijuana as Catholics. In episode 1, we talked about the Church's teaching about marijuana, arguing that it's actually immoral to use marijuana recreationally. Now, the Catechism gives us a good explanation of the Church's teaching. Paragraph 2291 teaches that drug use, besides on strictly therapeutic grounds, is a mortal sin. This condition of therapeutic grounds refers to legitimate medical treatment plans. Given what we have argued previously, then, the only time one could morally use marijuana is for a medical reason. Our task is to understand some of the parameters for such use. Marijuana is a weird drug. It is weird because it's the only drug where a somewhat mainstream subculture has arisen. No other culture in the U.S. has accomplished this. This means that we find marijuana used in all sorts of ways. One can find THC-laced candy, for example, or within baked goods. There are, of course, more traditional methods of smoking it, wax, shatter, hashish, and so on. None of these products, however, are medical. This is, in fact, a great parody of what medicine is. Medicine is not smoked. One does not take crushed Tylenol and smoke it in order to relieve a fever, nor does one vape morphine. One does not sprinkle Claritin into his or her brownie mix either. Neither or none of these examples are legitimate uses of medicine, even though the substances in question have valid medical purposes. My point is this. If you are going to treat marijuana as a drug, then actually treat it as a drug and as a food item. Drugs need to be scientifically proven as medically beneficial. One cannot claim that a substance has medical value and not actually research it out. It is furthermore irresponsible to use a substance for purported medical reasons and treat it so trivially by lacing candy and brownies with it. Drugs require years of patient testing and review. If marijuana is to be considered a drug, then it needs to be researched, not treated lightly. It should not be trivialized and put all sorts of food items without medical evidence that it is in fact safe to do so. We argued in episode 2 that marijuana is in fact a dangerous substance. By treating marijuana as medicine, then, it must be medically determined what is the proper dosage and be delivered by a valid drug delivery system. Smoking marijuana, for example, does not allow one to determine proper dosage. The chemicals responsible for the healing properties found in marijuana need to be distilled and placed in a proper drug delivery system. Otherwise, it is hard to determine how much to take. When one takes a migraine pill, for example, he knows that it has 500 milligrams of acetaminophen in it. THC and CBD likewise need to have proper dosage determined. Now, marijuana should not be smoked because marijuana smoke contains several toxins, including ammonia, benzene, toluene, and naphthalene. Furthermore, the habit of smoking marijuana has been linked to several respiratory illnesses. For these reasons, several medical groups conclude that marijuana should not be smoked for medical purposes because it is a dangerous activity. And this is why I've argued that one cannot morally smoke marijuana at all. And so this is also a reason why smoking marijuana is not a valid drug delivery system. Now, suppose that someone does have a medical diagnosis and believes that marijuana could help his or her condition. Does this mean that he or she can morally use marijuana? Well, not necessarily. It may be the case that one can illicitly use marijuana, but it can also be the case that it is still illicit for one to use medical marijuana, even if marijuana could be a possible treatment plan for him or her. To understand the conditions for when one can or cannot illicitly use marijuana for medical purposes requires understanding the principle of double effect. So, the principle of double effect has been taught in Catholic moral theology since its first formulation in St. Thomas Aquinas' Summa Theologica To understand how double effect works, we must first recall what Catholicism teaches concerning the morality of human action. There are three elements that constitute the morality of a human act. They are object, intention, and circumstances. The object is the object chosen in the action. It is the matter of the act. It specifies whether an action is morally good or evil. If one, for example, obtains an abortion, the object chosen is the murder of a child, and reason judges this action to be intrinsically evil. The intention is the second element, and it is the movement of the will towards the end or towards the object or end, and resides within the acting person. One can have a good intention while still performing an intrinsically evil action, such as Robin Hood stealing from the rich to give money to the poor. One can have a bad intention while performing an objectively good action and tarnish that act, rendering it evil. A medical officer might be interested in healing a patient only to torture him in the future. The act of healing is an objective good, but the officer's intentions here are evil. The operative principle here is that the ends do not justify the means. One's good intentions cannot justify an action that is intrinsically evil in of itself. Now, the third element is the circumstances of a moral action. These include the action's consequences. Circumstances alone cannot change the moral quality of an action. They do, however, contribute to the increasing or diminishment of good or evil associated with an action and a person's culpability. If one stole a loaf of bread because he was starving to death, the act of theft is an object is intrinsically evil, but the culpability is lessened because of the circumstances involved here. Now, some actions are evil irregardless of the circumstances and the intention. Fornication, abortion, euthanasia, murder, and sexual acts amongst gays and lesbians are all intrinsically evil in object, meaning that one's intentions or circumstances cannot alter the evilness of these acts. Now, a distinction needs to be made between two types of willed acts. If I kill someone as an act of murder, I directly willed the effect of that person's death. If I am attacked and defend myself, and as a result of my self-defense, the attacker is killed, this effect is indirectly willed. My intention was the defense of myself, and in performing this action, there was the unintended consequence that the attacker died. The principle of double effect gives us the conditions for when an indirectly willed evil effect is permissible for a given action. And double effect has 4 conditions. So the first condition is that the action itself must be good or at least morally neutral. One can never commit evil for good to come about. Let's see. Ends do not justify the means. The second condition is that the good effect must be the intention. One cannot will an evil effect for a good to result from it, nor approve of the evil effect that results from the act. Third, the good effect must not be produced by the evil effect, nor can the immediate effect be only evil. Both the good and evil effects must at least equally proceed from the act. And lastly, there must be a proportionate reason for permitting the foreseen evil. And we want to note this source. If you're interested in some further reading, Moral Theory by David Oderberg. Alright. Now, when we consider the question of medical marijuana, it needs to be tested according to the principle of double effect. The evil effects that may result are getting high and the adverse health reactions such as schizophrenia and paracognitive functions like memory, learning, attention, and hallucinations. Now, in application to the first condition, the object must be the restoration of health. No other object is permissible. The one cannot take marijuana for the sake of getting high, and it just so happens that his health is restored. We have to keep in mind that it is an intrinsic evil to abuse drugs. Now, in regards to the second condition, the marijuana user's intentions can neither be getting high nor should he desire getting high. The marijuana user's sole intention needs to be the restoration of health. In regards to the third condition, both the medically beneficial and detrimental effects would equally flow causally from the same act of consuming marijuana. Therefore, or providing that there is a medical benefit in the first place. And lastly, there has to be a proportionate reason for administering marijuana for medical purposes. And this we need to develop further. Alright, so marijuana is not a trivial substance, but highly dangerous. It requires prudent and responsible use. One cannot morally use marijuana to treat a headache since there are already less dangerous options available like aspirin and acetaminophen. If there is a safer alternative without the debilitating effects that marijuana has, then one is morally obligated to use the alternative. One cannot self-medicate with marijuana, but must work with a doctor in order to develop a proper treatment plan. This further requires a valid drug delivery system and proper dosage. One cannot vape or smoke marijuana for medical purposes. Marijuana is also not a dietary supplement, and so it cannot be treated as such. One cannot use marijuana for medical treatment when there's already cannabis-based drugs available for those particular conditions. So the FDA has approved Epidiolex, which is a CBD-based drug for treating seizures associated with Lennox-Gastaut syndrome, Dravet syndrome, and tuberous sclerosis complex. An important fact is that Epidiolex is the only FDA-approved drug containing CBD. Now, dronabinol and nabilone are also FDA-approved drugs and are synthetically derived from THC. Dronabinol is used in the drugs Marinol and Syndros for treating anorexia and AIDS patients. The FDA has only approved these 4 cannabis-based drugs. Marijuana itself is not FDA approved. Alright. So, according to the principle of double effect, there are times one can legitimately use marijuana for medical purposes, but medical marijuana needs to be treated like a drug and not trivialized as being done by the pro-marijuana advocates. In order to use medical marijuana, the 4 conditions of double effect must be satisfied. The object of the action must be the healing of the patient. One cannot intend getting high nor approve of getting high. There must be a proportionate reason for using marijuana because it is a dangerous substance. And there needs to be a proper treatment plan, proper dosage, and drug delivery system. One cannot, for example, smoke marijuana. One must also use a safer medical alternative to marijuana if it exists. It is immoral to use marijuana simply because it can cure a condition. There must be a proportionate cause for its use. Thank you for watching this video. If you enjoyed the contents of this video and want to dive deeper, you can find more information about our research on our website or by checking out our other YouTube channels on Catholicism and marijuana. If you want to support us, please subscribe to our YouTube channel, join our mailing list, and consider making a financial donation. We accept PayPal donations on our website and have a Patreon page where you can support us monthly and access special perks. Financial contributions go towards maintaining the website and purchasing required materials for our research. If you're interested in learning more about why The Catholic Church condemns recreational marijuana usage. We have a video dedicated to that topic, as well as an article on our website. In our next video, we explore the origins of modernity's drug crisis according to Joseph Ratzinger, the man who became Pope Benedict XVI. Thank you.